This video is going to go through some ACL rehab at around the week 8 to 12 mark. We'll go through some of the progressions, what we expect to see from these exercises, and some of the criteria to progressing on past the week 12 mark. It's important to remember that everyone will be different, the timescales will vary, and some patients just may need to be held back depending on the progression of the recovery. So we're going to start with a single leg squat. If your patient is able to do it, brilliant. However, you might need to keep them on staggered squats, double leg sit to stands. Obviously, some of the younger, fitter, more active patients will find they can do this exercise relatively early. However, we might need to start off quite high in terms of a high seat. We want to try and avoid, especially at the week 8 mark, doing a really deep single leg squat, but that should be in and around the week 12 mark, what we're trying to aspire to. Close to 90-degree angle where the back of the knee is in line with the glutes. So we're having that parallel 90-degree single leg sit to stand. However, as I said, throughout the weeks we need to progress to this as opposed to start to this. So I'll typically give it as an exercise, roughly 3 lots of 10 to 15 depending on the patient. The higher the seat, the easier it will be. We're looking for slow and controlled movements, ability to control the single leg squat rather than rush through it or touch down with the other side. You can have your arms crossed, you can have your arms by your side, you can have your hands on your waist. It doesn't really matter too much as long as we're consistent with what we tell the patient. As the patient progresses, they can add a weight or backpack with books, anything to make that exercise a little bit harder. At some point, more close towards the 3-month mark, we'll perform a limb comparison left and right. I'll stick in the link in the description to a protocol that is a good rough guide to follow. It's from Mick Hughes. But what I tend to do with patients is just compare both sides through limb symmetry. If the patient can do 25 on the non-operated side and maybe 10 on the operated side, then that is too much of a gap. We want to get a bit closer towards 80 to 90%. Maybe not 90% just yet, but we don't want to have a big gap between the limbs when we're getting towards the 3-month mark. I'll also leave a link in the description on how to calculate limb symmetry, which you can do with all these exercises. And that will give you the strength percentage between limbs. So next we move on to a single leg bridge. So we can make it a little bit harder by crossing the arms rather than having the arms on the floor. Having the foot flat on the floor and close to the body will bias the glutes a little bit more. If we want to make a bit more of a hamstring bias, we'll get the foot further away from the body. So it is good to vary up a little bit with the exercises at home. Maybe one day they would do glute bias, one day they do hamstring bias. And if the patient is finding one harder than the other, then we kind of know where the weaknesses are. Same as a single leg squat, we want as close together as a score as possible. More going from anywhere between 80 to 90% will be great at this stage. Obviously we would use it as an exercise initially, and I always tend to go for anywhere between 3 lots to 15 to 20, but that's just the way I approach it. Then we can move on to a side plank exercise. This can be done as an endurance test. If you were to look in the link in the description to the protocol, they say anything over 30 seconds is great, but I still go for symmetry between the two. If one side you can do 1.5 minutes and the other side you can only do 35 seconds, then you know there's like a big discrepancy there. You can either have the feet stacked on top of each other or the foot in front. So now single leg balance, but essentially what we're trying to do is just get as long as possible on one foot without touching down. If a patient can hold that for about 60 seconds, I'm quite happy with that. Then I'd make the exercise a little bit harder, maybe use a balance cushion. We can do eyes closed to make it a little bit harder too. Increase the time over week 8 to 12. So it's important to cover all bases, especially if you are dealing with someone that doesn't want to return back to sport. So we don't want to neglect calf raises. Use it as an exercise off the edge of the step, going up to the top for a couple of seconds and then back down again. Follow my same principles, aiming through 3 lots of 15 with a view to using it as a move on to the next stage test when we're comparing left and right closer towards the week 12 mark. The idea is from week 8 to 12, you're increasing the weight a little bit more on your partial range motion knee extensions. And that can be done with a really strong TheraBand, ideally in the gym, comparing left and right. Might even do some single leg presses. I mean, obviously with the non-operated side, you can go through that full range of motion. Once we get past week 12, we can usually start full range of motion knee extensions.